Hey everybody, this is Jeffrey here today with Dr. Bill, Dr. William Clearfield.
I'm not going to correct
Dr. William Clearfield at the Clearfield Medical Group here in Reno, Nevada. And each week, Dr. Bill has been giving us great tips on different like acupuncture tips. We've talked about the non-surgical facelift and aesthetics, right word?
Non-surgical facial rejuvenation. We'll just leave it at that.
Okay.
And we also talked about non-surgical vaginal rejuvenation.
Yes. So
for our
the
ladies.
We hope it's for the ladies, right? So anyway, that's actually more for us.
You notice I don't turn red in the face when
No,
we talk about that. And you do.
I do. Anyways, well, you were on. I was watching the news.
Ask the doctor.
And he was on Channel 2 News in Reno, Nevada. I don't have all the call letters. Sorry, guys.
KNTV.
KNTV. There we go. And you're on Ask the Doctor. So they had you on talking about what?
Well, we were talking about hair loss.
I knew that because
and specifically our vampire or PRP, platelet-rich plasma technique.
Okay. Explain PRP before we go any further. What that is?
Okay. So platelet-rich plasma is we draw your blood, a very nice sample.
Okay.
We spin it down a couple of times in a very high-speed centrifuge, not the low ones that you do when we just draw blood to analyze it for your blood sugar and see how much you've had to drink the night before.
Okay.
We extract the platelets from the plasma, and the platelets are very concentrated and they contain growth factors. They're akin to stem cells. They're technically not, but they're akin to stem cells. And what they'll do is when they come in contact with tissues that are damaged or in trouble, they will actually help revive them.
Oh, okay. And so this is used for athletes in joints.
Mm-hmm.
You use it for face, the vampire facelift.
Right. We use it for breast rejuvenation. We use it for vaginal rejuvenation. That's called the O shot.
Oh, okay.
And we also use it for men called the P shot. It'll make you a little bit bigger.
All right.
Much more
there
sensitive.
you go, guys. Don't buy those fake pills that don't do anything for you. Get the shot.
And as long as we have some live hair cells, hair follicles, we can actually help thicken and revive your cranium.
Really?
Yes.
I'm thinning right here.
Yes. Well, as long as you have, like over here, where there is no hair follicles, that's not going to be rejuvenated. But up here and on the sides, wherever there is thinning of the hair, even if the hair follicles are technically dying, we can actually revive them.
Really?
Yes.
Now, Joel, that's what Joel, when he was showing me his hair came back, is that what he did?
That's what he did.
Oh, because I got to tell you, there's a guy who's our camera guy most of the time, and he
had almost no hair.
He has no hair, and he's got
hair.
But
it's a whole process.
Yeah,
so
sure.
it's not
just
just
instantly.
Yeah. Well, not only that does it not work. It doesn't not that it works instantly. It takes about 2 months before you're going to notice any type of rejuvenation.
Okay.
And it takes a good 6 months before you're going to see a nice fill-in of hair growth.
Okay.
But we have to do a few preliminary things first.
Okay.
And that's what kind of makes us different than just a hair clinic. Okay?
Gotcha. Okay.
We need to know what your testosterone level is.
All right.
Because if your testosterone level is too low or too high, that is going to affect your hair.
Oh.
Okay.
All right.
There's something called dihydrotestosterone, which is a breakdown product of testosterone. And if that's high, that's where we get the male pattern baldness.
Okay.
Because this dihydrotestosterone actually strangles the hair follicles in your scalp. So if those are high, there are some medications, there's some herbal remedies that we can do to lower that level, to kind of unstrangle your hair follicles. Okay.
Right.
We need to know what your estrogen level is. Another breakdown product of
Do men have
testosterone.
estrogen?
Men have estrogen.
They do. Okay. I was like, I don't remember. I
Especially,
that class.
If you've had, you can have if you're having a bad day and you're kind of whining and moaning, right? Your estrogen levels are probably high.
I'm telling you, girls, I get the shot. I had the trifecta. I did a wine therapy, chocolate therapy, and shopping all in the same day, and I felt great. So, anyways, I must have a lot of estrogen.
I don't even know what to say about that.
I must have a lot of estrogen. I don't know. Anyways.
You know, we can check that.
Yes, you can. All right, excuse me.
The other sort of big entity that we need to know is we need to know what your thyroid is. So, you know, thyroid is that little gland here, and that's your gas pedal. It tells your body how fast or how slow to go.
Okay.
If your body's moving too slowly, which is most of the time when your thyroid is on the fritz, what happens is that your hair follicles need to turn over every 21 days. That's the way. That's what happens in the skin. That's where the hair follicles are. That's normal. If it's running too slow, which is 98% of the time when the thyroid is off, that's what's happening. Then it's taking too long. What happens is that the oils and fluids, the blood vessels, all of the structures that are in the skin dry out because they're not turning over as rapidly as they should. And the end result is for your hair is going to start coming out.
Oh.
If you have too much thyroid, the same thing happens.
So people
You
should
need to be Goldilocks.
People should get their thyroid checked how
Yes.
often?
At least once a year.
Okay, because there's a big thyroid problem and people don't know it. I didn't know I had a problem. And, you know, so it's like, but all the telltale signs, I've been around doctors long enough. I know like 90% of the
Not only that, I understand that you're able to pick them out in your clients now.
I am. I'm like, you know, your thyroid is out. So
we need to make sure that your testosterone levels are good, your estrogen levels are good, your thyroid's good. We need to back off on the junk food a little bit.
Yes.
Okay. I don't want to be seeing you at those specialty beer gardens.
That's
that you
not
like to
junk
hang out.
food. That's hops. I'm eating my hops. I don't get enough hops. So okay.
It's liquid bread, you know.
Yes.
You know, white bread.
It's okay. There you go. So
not really good for you.
All right.
Okay.
Let's go for
So,
vodka. And
assuming those are all good,
Mhm.
okay, assuming we have that all balanced, then we're still having some hair issues. That's when we go in and we do our PRP or platelet-rich plasma.
Okay.
Okay. There's some nutrients that we also want you to supplement. Also, zinc is a big one,
Oh.
and biotin. Those are the two big ones. There's a number of others. We want to make sure that your liver's working properly. You know, I know you've taxed yours over the years.
Oh, gosh.
So we use something called
It's designed to
N-acetylcysteine.
filter, right?
It is a filter.
I know.
It's filtering all that Budweiser you've consumed.
Oh, okay. There you go. All right. So okay.
So we want to make sure that those are all in adequate and good and running order. Okay. So what we'll do is we make what's called a ring block. So we put some anesthetic here and in the back of your head, and it numbs up your scalp from your eyebrows and all the way around, all the way up.
Oh.
Okay. So you really shouldn't feel much of anything.
Okay.
Okay. And we do it one of two ways. We'll take our PRP, our platelet-rich plasma solution, and we can actually inject it into the scalp. We make little quadrants, and we'll just in under the scalp, and we'll make we can do a half a dozen injections. Sometimes what we'll do, especially if you're either very sensitive or it's a more diffuse area, is we'll take the PRP and we'll use it as a serum, and we'll take a dermabrasion pen, and we'll do it that way.
Okay.
So dermabrasion is very quick, makes a quick little puncture of the skin. The serum filters in, and it actually closes over in less than 10 seconds.
Oh, wow.
So we get the PRP into your scalp without a needle.
Okay.
It feels like you're just a buzz or you know, like pins and needles in your skin.
So how long does I don't know, how many procedures do you do? I mean,
We usually do one, maybe a second one. Sometimes we have to do
really?
5.
Oh, so it's not like you have to do this every week or every
No,
month or whatever.
no.
Oh, okay.
Sometimes we'll add in what we call a laser. So there's cold laser.
Okay.
We'll sometimes do that, and we do that with a really cool. It looks like a baseball cap. It's a laser cap. You can go home with it.
Okay.
We use that you can use that every night.
Oh, okay.
There's no pain. There's no heat. No anything. You really don't feel anything. And what it does is, so the laser helps stimulate the follicles. Sometimes we'll make a solution. I like a 1% melatonin solution, and we have you rub that in.
Oh.
There's minoxidil solutions that we'll use sometimes also to keep the hair follicles stimulated.
Okay. So all right. So how long does the treatment does it take?
It takes about an hour.
Oh, okay. So there you go. So it takes a few months for it to start to show.
Yeah.
But so you don't have to have it. So I just want to make that clear. You don't have to have it done again, it just takes, you do it once.
We do it once.
Maybe
We'll have,
twice.
we'll have you come back in 2 months. If we're not seeing enough of a sort of like a sprout, almost like the
Garden.
Yeah, garden in the spring. If we're not seeing enough, we'll do it again.
And then how long does it last?
It should last 2 to 3 years.
Oh, so you maybe have to have it done.
You might have to, but again, the touch-ups are much less.
Oh, okay.
Much less. We just need to go into the areas where we're seeing a little bit.
Oh,
more
interesting.
Yeah.
Interesting. Cool. All right. So
you can be helped.
I can be helped. So it's on the website. It's under
Vampire. It's under the Vampire Techniques, and it says hair restoration.
Hair restoration project.
Project.
Hair restoration project. So if you actually Googled hair restoration project, you will find his website and information. So that's on there. And if you have any questions, call Dr. Bill. Call his office, and he will get right back to you. And
Do our best.
yes, and it is a great office. So everyone's so wonderful here. And I can't think of anything else. That's a lot. So if you're concerned about your hair and you really don't want to go get plugs, I don't really know what they do nowadays, other than
There's transplants. There's plugs.
You can grow it.
You can grow.
All right, awesome, Dr. Bill, great. So everybody, have a wonderful, wonderful day, and of course, always be a good human.